Hello, everyone. My name is Himnesh, and today the question that we'll be talking about is muscles of the fascia, muscles and fascias of arm and forearm. So this is one of the few questions that is some people find it very difficult and some people find it easy. So in the final exam, you'll basically it's not a very bulky question. That is, you just have to write three main things in the exam. First, you have to divide the muscles into compartments. Second, you have to write their origin, insertion, innervation function. And number three, you just need to make the drawings. But to remember those is a big task initially because there's a lot of muscles and you have to do it for the entire body. So what I have done is I've tried to explain it in a way so that you find it easier to remember. I'm pretty sure that if you watch the entire video and you have trouble remembering the muscles, origin, insertion, innervation, I'm pretty sure you'll feel better and more confident by the end of the video. But if you're someone who already knows this and just want to know what to write, I told you what all three things you need to write in the exam, and you're more than fine. Okay, so fascias as well. So the upper arm doesn't have any fascias as such. The main thing the upper arm has is the intermuscular septums. Even the lower limb, the upper limb and the lower limb both have just the intermuscular septums. What are intermuscular septums? They're just thin sheets of basically connective tissue which divides the muscle into compartments. So these intermuscular septums are responsible for dividing the muscles into compartments. Okay, you look at them when you remember the cross sections. So doing the cross sections is very important first because you need them for topography questions or the regional anatomy questions. They're separate questions in itself. For example, there's just one question for antebrachium, just one question for the brachium. You just need to draw those. So you cover three questions by doing this question. And plus you also need to know it makes it easier to remember the pathway of vessels and nerves, the path the vessels and nerves follow. So that's very important. We look at them at the end. Before we start, you need to know the brachial plexus very well, uh, because first of all, it's a question itself, and then number two, um, all the muscles of the upper limb are innervated by the brachial plexus. I'm pretty sure all of you know it well, but I can't recommend enough remembering the entire thing in this entire drawing. It's not very difficult. It's one of the easier things that you'll do in an art. Just one brachial plexus. Um, then, okay, let's begin. Let's begin with the upper limb muscles. First, we have the deltoid muscle. The deltoid muscle is, as you can see, it's wrapping around the shoulder. It's wrapping around the shoulder. It's moving anterior to posterior, okay? So what's an easy way of remembering trapezius or remembering deltoid is that it has the same origin as the insertion of trapezius. Okay, so let's talk about the origin. Origin is from lateral 1/3 of the clavicle, the acromion of scapula, and the spine of scapula. Okay, easy, right? Just think of the anatomy of bones. What do you have anteriorly? Anterior of the scapula. What do you have posterolaterally? You have the acromion. And then what do we have posteriorly? Posteriorly, we have the spinal scapula. Just move anteroposteriorly, and you can think of the origins themselves. Insertion is on the delta tuberosity on the humerus. Innervation is by the axillary nerve. The axillary nerve is from the posterior cord of the brachial plexus, and it innervates just two muscles. The deltoid and one muscle is part of the rotator cuff. So we talk about the rotator cuff now. What is the rotator cuff? This is the rotator cuff. Four muscles make up the rotator cuff. Rotator cuff muscles, I remember them as the muscles which are immediately around and originate on the scapula. Okay, what do we have? First, we have the supraspinatus, infraspinatus, teres minor, and subscapularis. Supraspinatus, as the name suggests, above supra to the spine, superior to the spinal scapula. So originates from the supraspinous fossa, inserts into the greater tubercle of the humerus. Then you have the infraspinatus. Infraspinatus originates from the infraspinous fossa, same insertion into the greater tubercle, innervated both by suprascapular nerve. Again, brachial plexus, so you need to know it absolutely. You don't need to know the root values, but if you know the drawing of the brachial plexus, it's very easy to make out the root values, and I'm pretty sure the professors are going to be impressed. They don't expect you to know, but if you write the root values, they're going to be very impressed. And it's not easy, it's not difficult if you know the drawing. So I'd recommend just remember the drawings and making out the root values, but you don't need them. Like they don't expect you to know right now. It's in fourth year that they expect you to know the root values in clinical nat. Then we have the teres minor muscle. Anywhere in the body, muscles, minor over major. The minor of the muscle, for example, teres minor will always be above teres major. Rhomboid minor above rhomboid major. Okay, so teres minor originates from the lateral border of the scapula and inserts into the greater tubercle. Same as the supraspinatus infraspinatus. Innervated by axial nerve. Axial nerve, two muscles, deltoid and teres minor. Okay, so you just need to remember the pictures. Just remember the pictures, then you can make out the origin insertion. You don't need to remember the origin insertion exactly, like as it says in the book, but you need to know it well. For example, you need to know the bone anatomy and you can make out the origin insertion. If you know the picture, you know the bone anatomy, you can make out origin insertion of the muscle. Function is always origin, pulse, or insertion. Okay, origin, insertion. For deltoid, origin, insertion. If this pulls, what will happen? The arm will be raised up, which is abduction, is abducting. It's moving away from the body. AB. When someone is abducted, they're moved away from where they belong. And adduction is getting added. It's moving towards. So when you pull the insertion, abduction. For most muscles, you can say that origin pulls an insertion, but there are certain exceptions, but they're not in the upper limb, but which are in which the origin does not pull on the insertion. Instead, the insertion pulls on origin. But in general, remembering that origin pulls on insertion is a good way of making out the function. You don't need to remember the functions by heart. Then you have the subscapularis, the fourth muscle of the rotator cuff, originates from the subscapular fossa of the scapula and inserts into the humerus, the lesser tubercle. Okay, lesser. The upper three, supraspinatus, infraspinatus, and teres minor, greater tubercle. Subscapularis, lesser tubercle of humerus, and innervated by the upper and lower subscapular nerve. The upper and lower subscapular nerve are also of the brachial plexus, so you need to know. Let's move on to the next muscle, which is the pectoralis major. The pectoralis major muscle, the pectoralis major muscle has three main heads. It has the not I won't say heads. It has three main parts. First, it has the clavicular part, the clavicular part, the sternocostal part, and the abdominal part. Okay, clavicular part, clear distinction. Sternocostal part, sternum and costa, ribs, and then abdominal part. By the name, origin, clavicle, medial 1/3, medial half of clavicle, then sternum, ribs 1 to 6, and then the rectus sheath. You've talked about the rectus sheath in the abdominal wall question. Um, so uh, just remember the parts, clavicular part, sternocostal part, and the abdominal part, and you can remember the origins. 1 to 6, remember ribs 1 to 6. There can be variations. Some books might say 2 to 7. That much variation, that much difference is acceptable. So inserts into the crest of greater tubercle. What happens is that there are two muscles which twist on the insertion. Pectoralis major is one of the muscles which twist and inserts into the crest of greater tubercle. You can see that it's twisting and then it inserts. Okay. Innervation, medial and lateral pectoral nerve. Then we have the coracobrachialis. As the name suggests, coracoid process, brachium. Brachium, arm. Okay. Coracoid process originates from the coracoid process, inserts into the brachium, which is humerus in line with the lesser tubercle. In line with crest of lesser tubercle, coracoid process. Easy, right? Coracobrachialis. So don't confuse coronoid process with coracoid process. They're two different things. Coronoid is in the ulna, whereas coracoid is in the scapula. Okay? Coracoid, coronoid, don't confuse. Innervated by the musculocutaneous nerve. So it's basically part of the brachial muscles, and anteriorly, all the muscles here that you will find here in this region are innervated by the musculocutaneous nerve. Okay, so coracobrachialis, musculocutaneous nerve. Then we talk about the next muscle is the subclavius. Subclavius, below the clavius, below the clavicle. Easy. Originates first rib, inserts into the inferior surface or inferior surface of undersurface of inferior surface is a better way of describing it. Inferior surface of scapular, subclavius. So for most muscles, you can say original pulsar insertion, but as you can like you can try it on your own. There's not much movement that can happen between. There's not much movement between the first rib and the clavicle. So the subclavius is mainly responsible for stabilizing the clavicle in the sternoclavicular joint. What is the main function of subclavius? Stabilizing the clavicle in the sternoclavicular joint. Okay. Innervation is by nerve to subclavius. It is its own nerve, has its own nerve from the brachial plexus. Then we have, since we have pectoralis major, we need to have a pectoralis minor. Remember picture. Where is it originating from? What is this called? This is called the coracoid process. So it's inserting into the coracoid process and originates third, fourth, fifth rib. First, second, nothing. Third, fourth, fifth rib inserts into the coracoid process. Easy. Innervated medial pectoral nerve. Pectoralis major, medial and lateral pectoral nerve. Pectoralis minor is by medial pectoral. Medial and lateral. Medial and lateral both. Okay. If you remember, not to complicate it much, but how I remembered is that why it's only by medial. If you look at the cadaver, you'd see that the medial is more towards pectoralis minor, whereas the lateral is more towards the pectoralis major. Like if you see it, if you've seen it in winter dissection, you know what I mean. But it's easy to remember that way. So minor, medial, and major, both medial and lateral. Then we have the serratus anterior. The serratus anterior, some books like themes divide into three parts: superior part, intermediate part, inferior part. But I just like to remember it as one muscle. There's no division into parts. Originates from ribs 1 to 9, ribs 1 to 9, and inserts into the medial border of the scapula. So it moves in front of the scapula, and then moves medial part, and then inserts into the border. So it's not attaching, it's moving anteriorly to the scapula, okay? You can see it's moving anterior, then inserts into the medial border of the scapula. This is a lateral view. This is a lateral view. So it moves 1, 9, moves medially in front of the scapula, in front of subscapularis into the medial border of the scapula. Innervation is by the long thoracic nerve. Long thoracic nerve, brachial plexus. Easy peasy lemon squeezy. Okay. Next, trapezius. What did we talk about trapezius? How's it easy to remember? Yes, you're right. The origin of deltoid is same as insertion of trapezius. Very good. Trapezius is divided into three parts depending on the direction of fibers. We have the descending part, the transverse part, and the ascending part. Descending part, you can see the fibers are moving downwards. Transverse part, fibers are transverse, and ascending parts, fibers are moving upwards. Okay, easy to remember. Then, what is the origin? The origin of the of the descending part is from the occipital bone, from the spinous process of C1 to C7 and the occipital bone, and it inserts. We can talk about insertion as one. There's no point of dividing the insertion of different parts into different things, but spinous from the occipital bone, spinous process C1, C7, and then we have the transverse part. The transverse part originates from the spinous process and aponeurosis of T1 to T4. So vertebral body, so the vertebrae, not the body, the vertebrae has a transverse process and a spinous process. So all of these are from the spinous process of C1, C7, descending, transverse, spinous process T1, T4, and then ascending part is from the spinous processes of T5 to T12. T5 to T12, okay. C1, C7, T1, T4, T5, T12, just continuation. It continues from C all the way to the end of T because C7, T12. C7, T12. So C1, C7, T1, T4, T5, T12. Easy. Okay. Just think you have to go from C to T. All the way you need to finish from all the way from starting of C to the end of the T. And you have to divide into 3 parts. Easy. Inserts. What are the insertion of deltoid? Say it with me. Lateral 1/3 of clavicle, acromion process, and spinous of scapula. Easy. Insert and innervation. Innervation is by accessory nerve and C3 to C4 of cervical plexus. Professors don't expect you to know C3 to C4 of cervical plexus, but it's good because you talk about the cervical plexus and you talk how it moves with the accessory nerve and it goes to innervate the trapezius. So it's a very interesting mechanism, and I think it's good to know, and it's good to let the professor know that you know that. But if you don't understand it, don't don't try to act over smart or don't try to over impress because they catch it and then they'll grill you for it. So only if you understand the entire mechanism, let them know that C3, C4, cervical plexus as well, but mainly accessory nerve is your main thing. Then you have the levator scapulae, levator scapulae. What does it say? Levator, levate the scapula. Origin C1 to C4, T1, C1 to C4 transverse process inserts into the superior angle of scapula. T1, T4 transverse process. So we talked that the vertebral body, vertebrae has transverse and spinous process. Trapezius, spinous process because it is behind. Levator scapula, you have one on each side. So transverse process, C1, C4. What has same origin as C1, C4? Correct. Descending part of the trapezius. C1, C4, but that's spinous process. This is transverse process. Inserts into the superior angle of the scapula. Easy origin position insertion, levator scapulae. Innervation is by the dorsal scapular nerve and cervical plexus. You can say C3, C4. Same. If you understand, only then say it. Then we have the rhomboids. We have two, minor, major. Which one would be superior? Which one would be inferior? Correct. Rhomboid minor over rhomboid major because anywhere in the body, minor over major. Origin of rhomboid minor, spinous process of C6, C7. You can see that rhomboid minor is not a very big muscle. Relatively small. C6, C7 inserts into the medial border of the scapula. Then we have the rhomboid major. Since rhomboid minor was C6, C7, rhomboid major is immediately below. So it'll be T1 to T4. T1 to T4. What has the same origin as T1 to T4? Correct. The transverse part of the trapezius. So you just need to relate things. And it's very easy to remember origin insertions. I need to remember pictures and relation. That's all. Inserts into the medial border of the scapula, same as rhomboid minor, but it is below because minor over major. Innervation by dorsal scapular nerve, both. Now let's talk about the latissimus dorsi. What did we say? What is common between the pectoralis major and latissimus dorsi? Correct. They twist on their insertion. Twist on their insertion. Okay. So same, like some people, like Themes divides the serratus anterior into three different parts. The latissimus dorsi is also divided into four different parts. I think if it's not completely necessary to divide them into four different parts, you just need to remember origin insertion. But for these two muscles, especially for serratus anterior and latissimus dorsi, um, it's not it's not very necessary to remember, but if you can, it's good. But for trapezius, you need to know because it's based on direction of fibers. This is just based on position. So for trapezius, you absolutely need to, all other muscles that we've talked different parts of, you need to know, except serratus anterior and latissimus dorsi. But it's good to know. If you don't know, don't panic. Four parts, what do we have? We have the vertebral part, the scapular part, the costal part, and the iliac part, based on where they're present. Vertebral, scapular, costal, iliac. Okay, easy. Origin T7 to T12. T7 to T12 spinous process and thoracolumbar fascia. Also from ribs 9 to 12. Ribs 9 to 12, spinous process T7 to T12, thoracolumbar fascia, and iliac crest. Very visible. Thoracolumbar fascia, iliac crest, 9 to 12 ribs, and spinous process T7 to T12. Easy. It inserts into the floor of the intertubercular groove of humerus, twists and inserts into the floor of intertubercular groove of the humerus. Innervation by thoracodorsal nerve, again, brachial plexus. Then another interesting fact that you can know is that the latissimus dorsi is also known as the cough muscle. That is, when you cough, you bend down and cough and try coughing. You can feel that lats are very constrict the rib cage and responsible for coughing. Then we have the teres major. Okay, where did we talk about teres minor? In what group of muscles? What's the group of muscles called? Rotator cuff. Very good. The teres major is not part of the rotator cuff. Only the teres minor is. The teres major is here. The teres major is here. Okay. The teres major originates from the inferior angle of scapula and inserts into the crest of lesser tubercle of humerus. Inferior angle of scapula, crest of lesser tubercle of humerus. Good. Innervation, lower subscapular nerve. Where did we talk about upper and lower subscapular nerve? Which muscle? Subscapularis. Very good. But teres major is only by lower subscapular. How to remember? Teres minor, major. Major is below. What will? Lower. What will innervate? Lower will innervate. Lower subscapular nerve. Easy so far, yeah? Now it's even easier. The brachium is probably the easiest part to remember in the upper limb muscles. What do we have? We have the biceps brachii. Remember to say biceps brachii. Don't forget biceps brachii. Brachii, don't forget brachii. Just don't say biceps because most of us are usually just using biceps. But brachii is very important when you're a medical student and learning anatomy. Brachii is very important. When you're at the gym, biceps will work. So the biceps brachii has two main heads. It has the long head and the short head. The long head originates from the supraglenoid tubercle, which is from the glenoid cavity. There's a tubercle on the superior part of the glenoid cavity. It originates from there. And then the short head originates from the coracoid process of the scapula. Both of them insert into the radial tuberosity and basipital aponeurosis. Basipital aponeurosis is, we have two main aponeurosis in the upper limb. We have the palmar aponeurosis and the basipital aponeurosis. Both are basically just extensions of the insertion of the tendon. Okay, there's not much you need to know about aponeurosis. Just know that they're connective tissue material stuff kind of in nature, and they're extensions of the tendon for insertion. Then we have the brachialis. The brachialis originates on the humerus, on the distal half of the anterior surface. Distal half, anterior surface, brachialis here. Here, distal surface of the humerus, and inserts into the ulnar tuberosity. Okay, I have a question. There's another muscle which originates here. There's another muscle which originates here and inserts into the humerus, inserts on the humerus. What's the name called? Coracobrachialis. Very good. Innervation, musculocutaneous. Very good. So all three of these muscles, musculocutaneous nerve. Innervation, because anterior compartment, musculocutaneous. Posterior compartment, radial nerve. What do we have in the posterior compartment? We have the triceps brachii. Don't forget brachii because there's triceps surae as well. Triceps brachii muscle. The triceps have three main head because tricep, three-headed muscle, tricep muscle. It has the long head, the medial head, it's hidden behind, and then we have the lateral head. Long, medial, lateral. Long head originates from the infraglenoid tubercle. Infraglenoid tubercle. Then we have the medial head. The medial head originates from the posterior surface of the humerus, distal to the radial groove. So what is the radial groove? Radial groove is basically a groove which is formed by the movement of the radial artery nerve. The radial nerve moves and forms a groove. So it's distal to the groove, whereas the lateral head is proximal to the radial groove. Okay, you know about the anatomy of humerus. So it's in the posterior surface, there's a radial groove. It's kind of moves like this, and it's proximal to the radial groove, the lateral head. All of the three heads insert the olecranon of ulna. Innervation, as I said, posterior compartment, radial nerve. Then we have the anconeus muscle. People tend to forget the anconeus muscle because it's a small muscle, but don't forget it. Small muscles, remember, triceps and anconeus. Posterior compartment, you need to know anconeus and triceps. Anconeus originates from the lateral epicondyle of humerus. Lateral epicondyle of humerus, which is some lateral epicondyle of humerus, and inserts into the olecranon like the triceps. All the posterior compartment muscles, easy to remember, all insert into the olecranon. All posterior compartment brachial muscles insert into the olecranon of ulna. Lateral epicondyle, olecranon, easy. Innervation, correct, radial nerve. Now we have a bit more challenging part, but we'll make it easy. Like all the muscles before were easy, even this is going to be very easy. So what we do is for the antebrachium or the forearm, we divide the muscles into three compartments. We divide it into the anterior compartment, the lateral compartment, and the posterior compartment. Okay, anterior, lateral, posterior. Anterior compartment muscles into three different layers. So three compartments. First compartment, which is the anterior compartment, has three layers. The first layer, lateral to medial, we have pronator teres, flexor carpi radialis, and palmaris longus, and flexor carpi ulnaris. Lateral to medial, say with me. First, pronator teres, flexor carpi radialis, palmaris longus, and flexor carpi ulnaris. So palmaris longus may or may not be present. The tendon is very visible when you when you oppose your thumb and pinky finger and join them. You can see the tendon in your wrist and the anterior compartment, anterior part. Origin insertion. Remember, flexor compartment, common origin is medial epicondyle of the humerus. So pronator teres has two heads. The humeral head originates from the medial epicondyle. Ulnar head originates from the coronoid process, not the coracoid. Coracoid is in the scapula, correct. Coracoid process is in the scapula. Coronoid is in the ulna, and it inserts into the lateral surface of the radius, distal to supinator insertion. So supinator muscle is present in the posterior compartment, and it also inserts into the radius in the proximal region. So it'll be somewhere here. The pronator is distal to it. So supinator inserts here, and the pronator is on the radius distal to it. Then we have the flexor carpi radialis, only has one origin, medial epicondyle of humerus, inserts into base of second metacarpal, second and third metacarpal, I'd say. Remember, base of second and third metacarpal, okay? Base of second and third metacarpal. Then we have the palmaris longus, middle epicondyle, same, inserts into the palmar aponeurosis. What is another aponeurosis that we talked about? You can see it in the picture. Bicipit aponeurosis, very good. For insertion of the biceps, okay? Palmar aponeurosis, bicipital aponeurosis. Then we have the flexor carpi ulnaris. Since it has ulnaris in its name, it's on the ulnar side, it will have an ulnar head. Two heads, humeral head, which is the medial epicondyle. All muscles have a humeral head, humeral epicondyle, medial epicondyle. And the ulnar head originates from the olecranon and inserts into pisiform, hook of hamate, and base of metacarpal. Okay, initially I found it very difficult to remember pisiform and hook of hamate, which it was because I didn't know. I forgot, like after doing the bones test, I forgot about the anatomy of the carpals. Just think about the anatomy of carpals. After pisiform, what do we have? In the distal row, what do we have? We have the hamate. So easy to remember. Ulnar head, what's the medial most? What's the ulnar side most carpal? We have pisiform. Then we move distally, we have hamate. And then base of metacarpal, okay? Origin, medial epicondyle, then olecranon, pisiform, hook of hamate, fifth metacarpal, base of metacarpal, easy. Now we move into the second layer. Second layer has the flexor digitorum superficialis. Flexor digitorum flexes the digits, flexes digits. Okay, so it has a humero-ulnar head and a radial head. The humero-ulnar head originates from the medial epicondyle of the humerus and the coronoid process of the ulna. What is another muscle that originates from the coronoid process of ulna? Pronator teres. Very good. Medial epicondyle, coronoid process. The radial head originates from the upper half of anterior border of the radius. Upper half of anterior border of radius, and inserts into the sides of middle phalanx of second to fifth digit. First, second, third, fourth, fifth digit. Second to fifth digit sides of middle phalanx. Proximal phalanx, middle phalanx, distal phalanx. Proximal, middle, distal. So what happens is the tendon moves here, and when it reaches the middle phalanx, it splits into two, one and two. Okay. It splits into one and two, and then it inserts in the sides. So moves here, then splits into two here, moves, splits here. Okay, so it splits just before insertion into the middle phalanx. Then we have the deep muscles. So we talked about the superficial most layer, we have talked about the middle layer, now we have the deepest layer. The deepest layer has three muscles, not two. A lot of people tend to forget the third muscle, which is this one, but don't forget it. It is also a muscle. It is relatively smaller, so a lot of people tend to forget, but don't forget it. First, we talk about the flexor digitorum profundus. Profundus does not directly translate into deep, but we can think of it, since it is superficialis in this middle layer, we can say that profundus is deep. Easy to remember, but don't tell the professor profundus means deep, because the direct translation from Latin to English is not deep. So don't say that. It originates from the ulna and interosseous membrane, and inserts into distal phalanx of second to fifth digit. Why does this split? Now we know the reason, because the profundus tendons move through the splitting into the distal phalanx. So the superficial is here, but the profundus moves through this into the distal. Okay, easy. Originated. I'll talk about the innervation of these muscles later, because it's a bit you can't generally say, generally you can generalize, but then there are a few differences I'll talk about once I'm done with the anterior compartment. Then we have the flexor pollicis longus. Flexor pollicis longus. What is flexor? Flexion. What is pollex? Pollex is the thumb, correct. Flexor pollicis longus. Origin from the radius and interosseous membrane. Ulnar interosseous membrane, radius ulnar interosseous membrane, radius interosseous membrane. Then inserts into the distal phalanx of the pollex, distal phalanx of the thumb. Easy peasy, responsible for flexion. Then we have the pronator quadratus. The pronator quadratus is, I'll try to draw it because you can't see it in the picture correctly, but it's like a quadrangular muscle. It's like this. You'll find it below the tendons. It's like this, the muscle, and it originates from the distal quarter, distal one third of the ulna, and inserts into the distal one third of the radius. Distal one third of ulna to distal one third of radius. Distal one third of ulna to distal one third of radius. Okay. Now let's talk about the innervation. Innervation, anterior compartment. You can make a general statement about the anterior compartment and say that the anterior compartment muscles are innervated by the median nerve, but there are two exceptions. First, we have the flexor carpi ulnaris, which is innervated by the ulnar nerve. Ulnaris, ulnar, easy. Because it has ulnaris in its name, it is innervated by the ulnar nerve. And the flexor digitorum profundus, only the deep, only flexor digitorum profundus, that too the medial two digits, that is the third, that is the third and fourth and the fifth digits are innervated by the ulnar nerve. The lateral two, that is the second and third, are innervated by the median nerve. Same as all other muscles, except, so two exceptions, flexor carpi ulnaris and medial two of flexor digitorum not superficialis, of flexor digitorum profundus. We talked about all these muscles. Now move into the lateral compartment muscles. Lateral compartment, three main muscles. We can move anterior to posterior. We have the brachioradialis. By the name, brachioradialis. Brachium to the radius. Originates from the distal surface of the humerus, lateral to muscular septum, and inserts into the stylar process of radius. You can see stylar process, you know the anatomy, stylar process of radius. Lateral compartment and posterior compartment by radial nerve. Lateral posterior compartment by radial nerve. Lateral and posterior compartment by the radial nerve. Then we have the extensor carpi radialis, longus before brevis. Longus means longer and brevis means shorter. Brevis is shorter. Okay. Extensor carpi radialis longus origins from the lateral supracondylar ridge of the humerus. Lateral supracondylar ridge, above the condyle. Lateral surface of supracondylar ridge, above the lateral condyle. Okay. and inserts into the second metacarpal. What was the insertion of the flexor carpi radialis? Second and third metacarpal. Correct. So easy to remember insertion. Second metacarpal and extensor carpi radialis brevis, third metacarpal. Origin, lateral epicondylar radius. Sorry. Easy. Innervation, radial nerve. Posterior compartment also innervation, radial nerve. Now we have the posterior compartment. The posterior compartment can be a bit tricky to remember, but it's not difficult at all. Okay. We've come so far, and I know it's a bit too much if you're watching for the first time, but I I hope you're remembering stuff as we go through the lecture. I've tried to make it as easy as possible. I'm trying to associate things together, and I hope you're trying to remember stuff along. Um, Now, the posterior compartment. The posterior compartment is usually divided into just two main layers, two main layers. Like the anterior compartment was divided into the three layers: superficial, middle, and deep. This is usually divided into just two layers. We can move um, we can move lateral to medial, like we're moving from anterior to posterior. Then we can just move lateral to medial. We talked about extensor carpi radialis longus. This is after extensor carpi radialis longus and brevis. You can see the brevis here, hidden behind. You'll have extensor digitorum. Extensor digitorum, like in the anterior compartment, the common origin was medial epicondyle. In the extensor compartment, the common origin is lateral epicondyle of the humerus. Okay. Extensor digitorum originates from the lateral epicondyle of humerus, inserts into the dorsal digital expansions of digit 2 to 5. This is called dorsal digital expansion. What happens is it's a bit complicated, but you can just think of it as splitting of tendons. It's not basically splitting, but you can remember it in that way because it's a bit more complicated than that, and you'll need it when you become a micro, I don't know, if you become a surgeon. I think that's when you require it more. But right now, just remember dorsal digital expansion and remember splitting and then converging. That's all you need to remember. Extensor digitorum, origin, common head, lateral epicondyle, insertion into dorsal digital expansion of digits second to fifth, second, third, fourth, fifth. Then we have the extensor digiti minimi. It'll be a bit difficult to see it here, I guess, because it's usually, yeah, it's here. It's a bit difficult to see because it's smaller, and as the name suggests, extensor digiti minimi extends the digiti minimi. What's the digiti minimi? Your pinky. Your pinky is extensor digiti minimi. I hope you can see it. Let's see if we can see it here. Extensor digiti minimi. Extensor digiti minimi. Oh, it's not visible here, but it's very slightly visible. It's like this one. So originates ulnar common extensor head, which is lateral epicondyle, and inserts into the dorsal digital expansion of fifth digit. Because what is the fifth digit? The pinky finger. Then we have the extensor carpi ulnaris muscle. Extensor carpi ulnaris. Extensor carpi ulnaris. What was the insertion of flexor carpi ulnaris? Fifth digit. Fifth metacarpal. Correct. Metacarpal, don't say digit. Fifth metacarpal. Correct. So the insertion will be the same. Fifth metacarpal origin is the lateral epicondyle. Obviously, since it has ulnar in its name, ulnar head will also be there. Posterior surface of ulna. That's it. Easy to remember. Very good. You can see the flexor as well here. Don't confuse it. This is the Anconius flexor, extensor is here. Extensor and inserts into base of fifth metacarpal. Now let's talk about the deep layer. We said that the pronator teres is or inserts into what? The radius, correct? Distal to what? Insertion of supinator. Supinator muscle is a bit complicated because you can think of it as just wrapping around the radius from posterior to anterior. So it moves posteriorly and then anteriorly and wraps around the entire radius. So it originates from the olecranon of the ulna, from the lateral epicondyle of humerus, and radial collateral ligament, and then inserts into the radius proximal to the insertion of pronator teres. You can remember insertions of the two muscles relative to each other. Then we have the abductor pollicis longus. It has two main origins. The extensor pollicis, abductor pollicis longus. Let's see here. Yeah, abductor pollicis longus. It has two origins, you can say. It originates from the ulna and the radius both, and the intermuscular, the interosseous membrane. And then it inserts into the base of first metacarpal, because why? Polypsis, base of first metacarpal. Then we have the extensor pollicis longus. We talked about the abductor, abductor. Then we have the extensor, extend. What is there, or the origins from the radius. You can see remembering pictures is very good. You can just remember the pictures and think of the origin insertion. Try to remember the pictures and origin insertions will come to you on your own. Extensor originates from the radius and inserts into the base of proximal phalanx, because extensor pollicis. Then we have the extensor indicis. Extensor indicis originates from the ulna and the interosseous membrane, and then origins from the ulna and the interosseous membrane, and then inserts into indicis. What is indicis? Indicis, index finger. It inserts into the posterior digital extension of second digit. Okay, so let's do it again. Supinator done. Supinator is not very difficult. Usually these muscles are a bit confusing. These ones, not brachioradialis, brachioradialis is not very confusing. What's confusing is abductor pollicis longus, extensor pollicis brevis, and extensor indicis. Remember, abductor pollicis longus, we have two pollicis, abductor and extensor. Then we have extensor pollicis brevis, longus, and brevis. Then we have extensor indicis. So three pollicis and one indicis. Abductor, extensor longus, extensor brevis, and extensor indicis. Remember and move lateral to medial, and you can think of the origins. Lateral to medial. Abductor is radius and ulna both. Extensor is radius. Longus is radius. Brevis is ulna. Longus is ulna. Brevis is radius, and indicis is just ulna. Lateral to medial, and then insertion. You can think of it by the name. Okay, you can see it here as well. Here it's a better picture. You can see intermuscular septum, ulna, radius. We've talked about this already. So axilla. This is not a compulsory drawing. It is not a compulsory drawing. However, there's a topography axilla question in which also it's not a compulsory drawing, but if you draw it, it's good. I'd recommend drawing it. It's not, it's one of the easier cross sections to draw. And you don't have to talk about it much if you draw this question, if you draw it in the axilla question, but it also helps you in this question to remember the origin insertions of the muscle and the placement respective to each other. These two I'd recommend learning very well because they help you with three things. First, they help you with the arrangement of muscles with respect to each other. Number two, they help you the path of the vessels and the nerves. So you can see how the nerves move from the upper arm into the forearm. And number three, it is very good for remembering where the intermuscular septums are present. You can see the intermuscular septums are darker. It's very important to remember these drawings. They also help you with, so in finals, some professors might ask you the origin insertions of muscles on the bone. They'll give you the bone and then tell you, okay, tell me what muscles originate here and insert here. One thing that helps is this, and then another is drawings like these. You can see the origins here and then the insertions here. Netters has a very good picture that can help you that for the practical part of the exam, but a lot of professors like asking, they'll give you a bone and then they'll ask you what muscles originate and insert. Tell me exact points on the bone. So Netter's picture for that, and this is very important. These drawings are very important to remember because they are a question on their own. And finally, thank you. I hope you gained something from it, and I hope you watched it on 2x because I took time to explain it. Um, and I don't know, I keep trying to turn my camera on, but it's not letting me. Um, anyways, I tried to explain it as much, and anyways, my picture is not important. It's not important to look at me. Um, I hope you don't have doubts, and if you do, you can any day, anytime ask your seniors. Okay, and best luck for your exams. Bye bye.